I have been practicing surgical hair restoration for over 15 years now. And from my experience, I can vouch for the fact that though a spotless, immaculate hair transplant procedure is in the hands of the surgeon, the outcomes at times are not. Because there are many variables. And in this scenario, if you're looking for a hair transplant and have unrealistic expectations, and you feel that the surgeon who's treating you is wielding a magic wand, well, you've got another thought coming. As many of us discuss, many of my colleagues in the hair restoration field discuss very often, that the situation in hair restoration surgery, the condition of hair loss sufferers, is very grim. Over the years that we've been in practice, we've noticed that the donor areas are dwindling. People have unrealistic expectations. People do not want to take the medications. And this does not behove too well for both the hair loss sufferer and the treating hair transplant surgeon. But hair restoration surgeons are adapting. They are adapting rather well to this change. As far as my practice goes, if you have any of the risk factors that I'm going to enumerate, it is definitely going to affect how I treat you medically and how I treat you surgically. Do you have pre-existing erectile dysfunction? Do you have hypogonadism? Are you overweight? Do you have an obsessive compulsive behavior? Are you under 25 years of age? Are you prone to making hasty decisions? Do you feel that the doctor you've chosen has full control over your hair loss, hair regrowth, and hair transplant results? Do you feel that various other modalities of treatment like minoxidil, oral minoxidil, topical dutasteride, derma roller, and various other natural products which are said to contain DHT blockers are a replacement for finasteride and dutasteride? Are you planning a family in the next 6 months after a hair transplant? And last, but very importantly, are you finasterophobic? Well, if the answer to any of these questions is yes, this video is meant for you. These are the various risk factors that a hair transplant surgeon should keep in mind before deciding on the course of treatment for a hair loss sufferer, whether he has thinning of hair or he's outright bald. These are the risk factors which I have enumerated, and they work well for me while counseling a patient and while deciding the course of treatment, a comprehensive plan for treating this patient for not 1 year, 2 years, but for a period of 10 to 15 years as his baldness develops, as his baldness progresses. Because a hair transplant has no control whatsoever over how the baldness will proceed in the years to come. So that is why we need a plan. That is why we need to have a clear vision of how things are going to shape up, of how the patient's objectives and goals that he set out with need to be met in the years to come. A holistic approach to hair transplant or towards management of hair loss is very important today. If you value your hair and if you think that you will continue to value your hair in the next 10-15 years, you need to make a solid plan. And this video is all about how to make a plan which is holistic, all-inclusive, and based on various parameters and risk factors that you may have for the future. Of all the patients that I consult with on a daily basis, almost 50% of these patients are those who need to incorporate finasteride or any other DHT blocker into their regime if they need a plan that will work. However, due to the overload of messages, overload of information on social media platforms which are commercially driven, many patients today think that there are alternatives for DHT blockers. No such alternative exists. This is mere glib talk which is commercially driven, and it is not in the patient's interest to not to take finasteride in almost 50% of the cases. Every medication in allopathy has its side effects, and finasteride is not unique. Take for example Tylenol, a very commonly drug taken all over the world. In India it's called paracetamol. We feel it's a very innocuous drug. We take it almost every other day and without giving a second thought to it. But do you know the amount of side effects that it has? This table lists the side effects, and it also lists the side effects that you can experience with a single dose of Tylenol. Every drug has a side effect. But are we not going to take this medicine because of the side effect, because of the stated remote possibility of a side effect? And we have to use a judgment, and there is a cost-benefit ratio to everything in life. And so it is to the use of finasteride in hair loss. The side effects, at least in my practice, are so remote that a person who chooses not to take finasteride is doing gross disservice to his objectives and his goals of hair restoration. Today, we all know a hair transplant practice receives almost 75% people in the age group of 25 to 30. What does this mean? This means that hair loss or baldness is becoming increasingly common in this age group. Whereas earlier we were treating a broad spectrum of various age groups, now there is a flood of patients who are 25 to 30 and many times even less than 25. Patients as young as 15 to 18 years are reporting significant hair loss and baldness. The situation is pretty grim. In this background, thinking that hair transplant is a standalone procedure which will meet your objectives, is like the attitude of an ostrich. And this age group of 25 to 30 is the time when libido is at its peak, when the hormonal levels peak. And this is the time when patients show concerns of sexual drive and performance. And this is the time when we are advising them to take finasteride, because hair loss is most common in this age group, 25 to 30. So a deep counseling, a deep understanding of the patient's psyche, winning over the confidence of the patient while planning hair restoration for him is of paramount importance today. It was never like this before, but today, increasingly, it is important for the patient to realize that the drug finasteride, that the drug dutasteride, in certain situations only, is being advised keeping his best interests in mind. No surgeon will definitely prescribe finasteride or dutasteride in an irrational manner if he thought that his patient who has entrusted his care unto him is going to suffer from side effects and gross side effects like loss of libido, loss of drive. No surgeon is going to do that. So whenever a surgeon advises you that is in your best interest, you can discuss with him and then decide whether you are going to follow the path that the surgeon sets out for you. Well, there is no forcing you. That is completely your decision. An important point to note while taking finasteride or dutasteride for that matter is that according to the Massachusetts male aging study, over 52% of the population has erectile dysfunction. Well, this is the prevalence of erectile dysfunction in the population as stated by this large study. To be more precise, according to the study, 40% of the men by the time they are 40 and 70% of men by the time they are 70 will have some amount of erectile dysfunction. So age, according to the study, is the variable most commonly associated with erectile dysfunction. So when we talk about side effects of finasteride in the age group of 25 to 35, we also have to take note of the fact that many in this age group have pre-existing erectile dysfunction, which may be unmasked by the use of finasteride. It is not finasteride which is solely to blame. So these things have to be taken into account, and please do not believe outright what you are told by the internet. Research the topic, talk to patients who have been taking finasteride for a long time. There are patients in my practice, for instance, who have been taking finasteride for over 15-20 years and no side effect whatsoever. I myself have been taking finasteride for almost like 6 years now on a regular basis. So all this hype about side effects of finasteride on the internet that you very commonly encounter may not serve your best interests. You have to take a clear-cut decision. You have to take your own decision and see what is best for you, because if you value your hair, you have to have a plan before you set out towards hair restoration, and especially surgical hair restoration. more so if you are less than 30 years of age. Though there is a select group of patients in whom finasteride is an absolute must, there is an age group, especially over 35 years, in which after careful selection, and if the patient is hesitant in taking DHT blockers, one can give a trial with less number of grafts and see how the patient responds without DHT blockers, and then do the whole procedure. Because this age group is not the age group where the side effects of hair transplant are stated to be encountered in more than 0.25% of the cases. And these are the patients in which my ANAGEN Q+ technique, that is selectively harvesting ANAGEN grafts, which in the 6 months post-transplant will better withstand the negative effects of various factors that keep the grafts from growing immediately after hair transplant. Because ANAGEN hair are robust hair, and ANAGEN hair can withstand the regrowth process better than any other hair, and at times even without the support of finasteride, provided you fall in that select group of patients in whom a hair transplant without finasteride can be contemplated. So I would like to today share with you certain decisions that I make in my decision tree of whether to prescribe finasteride to a patient or not, of whether this patient would be an ideal candidate for a hair transplant with or without finasteride, or whether this patient is a candidate for any treatment whatsoever and needs to be refused hair loss treatment and hair transplants. Well, in this decision tree, androgenetic alopecia can be either manifest as thinning or it can be manifest as baldness. When it is merely confined towards thinning, that is the early stage of male pattern baldness, medical treatment comes into play. And when this progresses towards baldness, medical treatment with hair transplant or without hair transplant or hair transplant alone can be decided upon, and this chart shows my decision-making process. So when a patient is merely thinning and he's under 21, he needs to be counseled properly, and mostly he requires more psychological counseling than anything else. Finasteride is a big no-no. I do not prescribe finasteride below 21 due to several reasons. These patients, besides deep psychological counseling, are advised minoxidil, derma roller, and various other medical treatments that are in our armamentarium today. However, if a patient is above 21 years of age and he has risk factors which I enumerated during the start of the talk, no finasteride is given. He is managed as I would have managed a person who's less than 21 years of age without risk factors. And if a person is more than 21 years of age and there is no risk factor whatsoever, I will do hormonal testing on him, testosterone and estradiol levels. And if they are abnormal, I will desist from starting that patient on finasteride or dutasteride. When the hormonal levels are normal, I have no hesitation in starting the patient on finasteride 1 milligram a day, along with other forms of treatment like minoxidil, with or without PRP with A-cell, with or without derma roller, and a host of other treatments. On the other hand, if a person is balding, I divide the treatment according to the age broadly into 25 to 30 years age group and then above 35 years age group. I do not offer hair transplant to any patient who is younger than 25 years of age, unless of course he has other forms of balding like sick pattern traction alopecia, or it's just a hairline correction that is to be done and there is no overt sign of baldness or a history of baldness in the family. So if a patient is between 25 to 30 years old and he is suffering from baldness and he has risk factors that I have enumerated, I will not offer finasteride and I will not offer hair transplant in this patient. Why? Because at 25, if he is experiencing baldness and I cannot start him on finasteride after hair transplant, I am not sure of how his baldness will progress. I am not sure how his donor area will progress in the years to come. I do not want the hair transplant procedure to be an exercise in futility. So I would have reservations about doing hair transplant in a patient who's 25 and on whom I cannot start finasteride. These are the patients who should be routinely refused hair transplant. And then there are patients in the 25 to 30 years age group who have no risk factors whatsoever and show no hesitation in taking finasteride. These are the ideal patients for a hair transplant in whom a long-term goal, a long-term hair transplant plan can be made for their treatment. And these are happy patients in the long run. And these are the patients who are more realistic in their outlook, who are more ready to try finasteride. And these are the patients in whom a trial of finasteride can be done. And even if the trial proves negative, we can consider doing hair transplant procedures on them. But these procedures, when done, should be limited to low numbers to study in the 6 months process after the first hair transplant of say about 2,000, 2,500 grafts, how they responded to the surgical hair restoration, how the hair regrew without the protective umbrella of finasteride or dutasteride. In this age group, the best patient is one who has no risk factors whatsoever and who has no compunctions, no hesitation in taking finasteride, and who undergoes a hair transplant. This is the best patient in my practice, and I'm sure in most of the practices as well. Well, this is my decision-making tree, and if you have any questions about this, please do not hesitate to ask and I'll be very happy to answer. So to conclude, the question, is finasteride necessary for a hair transplant procedure? Well, my answer is, and I won't shy away from it, is that yes, finasteride is an absolute must in a select category of patients. A hair transplant cannot be done in this select category of patients who refuse to or who are not eligible for the use of finasteride because they have certain risk factors. Till we have an alternative to finasteride, and I'm sure it's coming in the next 2 to 3 years, finasteride cannot be ignored. Finasteride cannot be bypassed if you're planning a hair transplant procedure, especially if you are young and you're heading towards extensive baldness. So that is the message I have for you today. And if you have any comment, if you have any doubt in your mind, if there's any question about finasteride that is troubling you, please do not hesitate, leave a comment below and I'll surely answer back. Thank you for watching and God bless.